Hello everyone and welcome back to JS Outdoors. Today I want to spend a little bit of time and talk about wound packing. Wound packing is a very basic and simple skill to have that could keep yourself or someone else alive if there's a situation where you have massive bleed. Considerations for wound packing would be an injury where topical pressure on the injury area is not enough to stop the bleeding. These injuries can be small, like a bullet wound or some sort of puncture wound, but can also be something large, like a large laceration due to like a knife wound or cutting yourself on glass. These types of injuries can also happen in everyday life. It doesn't have to be necessarily something where your profession or something that you do is high risk, like shooting or being in law enforcement or being in the military. But these can also be something that happen at work, like if you work in a shop and let's say you cut yourself on a knife because you're trying to do something with a knife and now you've got a large bleed that you can't stop with that topical pressure. These are going to be really good tools and things to keep in mind when you're dealing with an incident like this. I hope this video provides you with some sort of information and tangible skill that you can use out in the future if you ever do encounter some sort of bleed like this caused by an injury. Keep in mind, this video is not medical advice, and it is important for you to seek out medical training to be able to tangibly practice these skills so that you can better implement them if you do encounter them in the real world. So the first step to this is the materials that you have available to you, and that's going to ultimately depend on your preparedness level. Some people will take it upon themselves to get preparedness kits, and we do sell some on our website. Or other situations will cause for improvised tools like a clean shirt or something that you find that you're able to pack that wound with. On our website, jsoutdoorsllc.com, we do have a couple kits that are already prepared for you, and these will have just about everything you need to help stop a bleed. We have a basic kit, which is a little more lower level and it is a cheaper cost. We also have the advanced kits, which will have a couple different options over the basic kit. It'll have some gauze with hemostatic agent in it, and it'll also have some chest seals for like sucking chest wounds. We're not going to get into that with this video, but just know that the advanced will have a little bit more for you there. Going back to briefly touch on the improvised tools that you might use, like a clean cloth. We want to make sure that stuff is clean. So we don't want to be using something that's covered in oil that you found in the shop, because ultimately what you're doing with that is you're introducing something else into the body, into that cavity, originally with good intent trying to stop something, but it could cause complications down the road. Wound packing gauze is going to be one of your better case scenarios to have on you. It usually comes in a vacuum sealed package, and it's in a Z fold for the most part configuration, so it folds out like a Z, kind of like an accordion. In both the kits that we offer, both the basic and the advanced, we have something that's called the wound packing gauze. Now this is by North American Rescue, like the rest of the products in that kit. However, what this specific gauze has is it has a strip in it that's able to be detected by x-ray, so that way when yourself or the person who you're trying to assist needs to go and then get the remedial in hospital care, they'll be able to identify that through x-ray if it's not obvious during the time that they arrive. Now the advanced kit's going to have something that's a little special as well. It's a Celox gauze. Celox is a brand of hemostatic clotting agent. Basically what that does is that creates an external clotting, not using the clotting agents that are in your body, but it externally does that through the product of Celox. Essentially what that Celox does is it swells and it creates a gel, and then that's where that clotting comes into place. And what that's really important on is it's stopping the bleed. It's like kind of creating an internal scab. Not necessarily a scab, but it's the similar premise. Other forms that we're not necessarily going to get into in this video are also a granulus. So it's basically like a powder or like kind of like large pieces of sand, maybe not sand, maybe like rice. And what that'll do is it's kind of an injection or a pour in. So you pour that into the open wound, and that's just directly placing that clotting agent into that wound so that way the clotting process can occur. A really important tool when you're dealing with someone else's fluids, especially if you don't know them, is nitrile gloves. Nitrile gloves are important because if it's wet and it doesn't come from you, you don't want to touch it with your bare hands. The biggest thing to keep into consideration is any sort of open wounds you might have on yourself, any sort of cuts or dings. You want to be careful and try to protect those areas because that could be a passageway for some of those diseases to get into your body. All right, for this, we have our simulation body part with our injury here. First thing you want to do when you are dealing with a medical situation is you want to make sure that your area and your scene is safe to work in. So make sure that there's no external hazards that could occur. Don't want to be in the middle of the roadway in a very active roadway, but we also want to consider, is it feasible to move this person? So there's a lot of considerations to do there, and if you take a first aid class, they'll go into that a little bit more, and that's highly recommended. All right, we've determined that we're safe to work in this area, so we're going to put on some PPE, or personal protective equipment. In this case, it's going to be our nitrile gloves. I prefer getting nitrile gloves because some people have a latex allergy, and we don't want to be adding injury in this case. All right, so we're going to grab our gauze. In this case, it's an ACE bandage. And we're going to remove all of the packaging from this. So a lot of the times, like I was saying before, your gauze will come in like a vacuum sealed or some sort of container keeping it sterile. So you're going to want to remove that, get that out of the way. And then what we're going to do is we're going to take a little bit of the gauze in our fingers and we're going to push down and hold pressure. Then, with our other hand, we're going to make some gauze available and then get it ready right next to the injury here. And then we're going to come up with our hand that's providing pressure and then push back down again as we're adding more material into this wound. And then we're going to repeat that process. So get a little bit more material ready and available, get it down next to the injury, take the fingers that's holding pressure, and then pack that in. We're going to repeat that until the wound cavity is full. So about right there. And then we're going to hold pressure here for about 3 minutes. So one thing that you can do while you're holding pressure or have someone else do is do kind of a sweep of the person who you're rendering care to see if there's any further injuries, because we'll want to try to mitigate those as well. For this example, we'll say that there's no other injuries and this is our sole focus. So we're just going to continue to hold pressure here for about 3 minutes or until help arrives. So help would be emergency medical services, ambulance. Let's say there's an instance where you're out in the woods and you're hunting and you sustain some sort of injury like this, or your buddy does, and you've rendered aid to this point. Holding for 3 minutes and then having paramedics show up is probably not a feasible option because you might not be close to emergency services. So in this instance, what you would want to do is you would want to prepare the person for transport. So what that would look like is removing this excess gauze right here, because we don't want too much there. And then we would get like a compression bandage, or an Israeli dressing as sometimes it's called. We would wrap that area and then apply the pressure mechanism, which is usually like a plastic bar. In this case, we don't have one open right now, so we'll just use the rest of this dressing to kind of show that we've got this person ready to transport. All right, so let's say you've gotten to this point, or you're holding pressure and you're still seeing a lot of blood coming out. You're not able to stop that bleed. From there, you're going to want to move to a tourniquet. So we just recently did a video on applying a tourniquet and kind of the basics around tourniquets, and we'll link that in the video now. But if we're identifying that we're not able to stop this without some sort of mechanism, we're gonna go to the tourniquet. So just instantly go to the tourniquet, deploy the tourniquet, get it on that person. That way you can transport. So it's going to be the same for these two types of injuries as well. This one's kind of a cavitated laceration, so it's going to be the same thing. We're just going to hold pressure in there. We're going to create more material, put it next to our wound, pack it in there, same way we discussed before. Go until that cavity is full. Once that cavity is full, we're not going to use a lot of excess material, so we're just going to hold pressure here. Again, holding pressure for about 3 minutes or until paramedics or other trained personnel who can transport this person arrive. Again, if we're in a situation where we're in the woods or paramedics aren't easily able to get to us, we're going to want to consider transporting that person. So again, we'll prepare this person with an injury for transport. So it'll either be that pressure bandage or Israeli dressing. Get that taken care of if there's continual bleeding after we've done all of these remedial actions to try to pack the wound and hold pressure. So if it continues to bleed, again, we're going to move to that tourniquet and tourniquet that limb. Now, again, this only works when when it's on a limb. So if this is on the chest cavity or anywhere that's not on a leg or an arm, you're not going to be able to tourniquet. All right, hopefully you found some benefit to this video, and hopefully it gives you a little bit better understanding of how to pack a wound. If you feel like I missed something, or if there's a better way that you've done something in the past, feel free to leave a comment so that everyone can read it and kind of learn at their own pace and kind of pick up on different things that people have found from different experiences. If you're interested in getting your own Stop the Bleed kit, again, we do have them available on the website, jsoutdoorsllc.com. Our kits are made from North American Rescue, so it's a high quality product, trusted product, and it's none of that Chinese garbage that you see on Instagram. If there are other videos that you guys would like to see, medical, outdoors, fishing, hunting, whatever it is, leave us a comment below. Let us know what you want to see. We want to make content for you guys. Be sure to check out our social media pages. We've got Instagram and Facebook, and we also have our website, jsoutdoorsllc.com, where we do provide the North American Rescue medical products. The most important thing is that you're practicing this stuff. All of this diminishes over time. Make sure that you're getting the repetitions in, practicing putting on tourniquets with your specific training tourniquet. Don't use the one that you're going to use. Practice packing wounds. Get a towel, wrap it tight, make a cavity for yourself, and then practice packing that wound. There's lots of other options out there. You could practice with a small toilet paper roll that you've cut into a quarter and then wrap that up into a paper towel. Find ways to get out there and practice this stuff.